The Well Child Checkup or Well Child Exam is an excellent opportunity for you and your healthcare provider to see how your child is growing and developing. Checkups should be scheduled at regular times starting when your child is a baby through the teenage years. Regular exams help keep your child healthy by finding problems early so that they can be treated before they become serious. A specially trained healthcare provider, such as a doctor or nurse, performs the checkup. The checkup is also a perfect time to get answers to any questions you may have about your child's health or development. Before your appointment, try to write down these questions so that you can take them with you on the day of your visit. If you are worried about your child's emotional or mental health, talk to your provider about your concerns. Like adults, children can also experience worries and problems that may affect their health. By catching these problems early, you can help make sure that your child develops into a healthy, happy adult. Why do kids from babies through teenagers need complete checkups? To see how your child is growing and developing, to find problems early so that they can be treated right away, to get answers to any questions you may have, to make sure they have the shots or immunizations they need to protect them from very serious diseases, and so you can talk to the doctor about how you are feeling. When you arrive for your appointment, you may need to fill out some papers that ask about your child's health. If you have trouble understanding any of the questions, ask the receptionist for help. If your first language is not English, be sure to ask for an interpreter, and every effort will be made to get one for you. An interpreter can help you to communicate with your provider throughout the exam. The exam will take place in a private room, and you can be with your young child the entire time. Your healthcare provider will spend a few minutes getting to know your child and observing how your child is growing and developing. He or she will also ask you, and any child able to speak, some questions. Some of the topics that may be discussed include immunization, nutrition, oral health, learning, and safety. Older children and teenagers often have part of the visit alone with their provider. However, it is still very important for you to have time to ask questions, so please continue to go to visits with children of all ages. During the physical examination, the healthcare provider or assistant will take several measurements, including height, weight, and vision. Sometimes it may also be necessary to take a sample of your child's blood or urine. If you have questions about any of these tests or are uncomfortable, tell your provider so that you can discuss your concerns and decide together what to do. Depending on his or her age, your child may also need to receive some immunizations during the visit. Immunizations, sometimes called shots, protect your child against many dangerous diseases. It is important that your child receives them at the right time. If you have a record of your child's immunizations at home, be sure to bring it with you on the day of the exam. Keeping your child's health records up to date is very important. You will need this information to enroll your child in school and many other activities. If you do not have your child's records, ask for an immunization record card during the visit. What happens during a checkup or well child check? Kids get a physical exam for health problems, shots they need to keep them healthy, a vision test so they can get glasses if needed, and a hearing test. Parents and kids can talk about safety, weight concerns, healthy eating and exercise, how things are going at school, feelings, especially depression and how to get help, puberty, risky behavior like tobacco, alcohol, and drug use, and family problems. Parents often see things at home the doctor can't see. Be sure to ask about anything that worries you. At the end of the visit, you may be given papers that show what was done during the exam, or that have information about your child's health and development. You should keep this information in a safe, secure place and take it with you every time your child receives any healthcare services. You may be able to schedule your child's next appointment before you leave. If you think you will have trouble getting to your next appointment, let someone at the office know. Ask for help to make arrangements for transportation or any other services you may need. Remember, you are your child's most important caregiver. If you have any concerns about your child's health before your next well child checkup, call your healthcare provider. A nurse may be able to answer your questions over the phone. By working together, you and your healthcare provider can make sure your child receives the best possible care. If you need help finding health care for your child and are anywhere in Washington, contact Healthy Mothers, Healthy Babies at 1-800-322-2588. In King County, contact Community Health Access Program at 1-800-756-5437 or Kids Get Care at www.metrokc.gov/health/KGC. Remember to bring with you a record of shots or immunizations, healthy options or other insurance card if you have one, and a list of questions to ask the healthcare provider. Try to go to the same doctor or healthcare provider each time so she or he gets to know your family. Call the clinic the day before if you have to cancel your appointment, and when you make your appointment, ask for an interpreter if you need one. This film was brought to you by Kids Get Care, a program of the King County Health Action Plan, Public Health Seattle and King County. Kids Get Care's goal is to ensure that children, regardless of insurance status, receive early integrated preventive physical, oral, developmental, and mental health services through attachment to a healthcare home. For more information about clinic locations, training, and assessment tools, see their website at www.metrokc.gov/health/KGC.